So one of the questions that as therapists that we are frequently confronted with is whether our clients can engage in moderation or gambling without problems. Frequently they come in, they're experiencing a lot of problems due to their gambling, whether it be financial, family, other social problems. They're gambling to escape, they're not dealing with their problems. Can they engage in gambling in such a way that it doesn't cause problems? And the answer is it depends. Our clients, one thing with moderation is that it expands access to treatment. If we run abstinence-only programs, clients may hear that they have to stop gambling and they decide, you know what, I'm not ready to quit, I'm not ready to stop, and so I'm not going to come to your treatment program. Versus if you have moderation as an option for them, they may begin to say, okay, I can come in, I can engage with you and start with treatment. When you consider moderation, we can draw off of the alcohol research, and it says that some people can engage in moderation. Typically there's two pathways to moderation for people with alcohol problems. One way is that they will begin a period of abstinence from anywhere from 3 to 6 to 9 months, and then they slowly re-engage with alcohol, but they keep it at a level that is not problematic for them. The other way is that people just slowly cut down over time, and then over time they get to a point where their drinking does not cause them problems. When you're considering moderation for your clients, one of the things to think about is, does their social support network support them to continue gambling in a way that does not cause problems? Some families, in some situations, if the person was to gamble, it would cause a lot of distress and a lot of harm, and so for that client, it's not an appropriate situation for them. They also have to be generally functioning well. They have to be able to keep it. In considering moderation with our clients, we have to come up with some specific behavioral guidelines for them. They must have some guidelines. And generally what the research literature suggests for gambling problems is that if you want to gamble problem-free or below a level that's going to cause you harm, then you need to gamble no more than once a month. Your gambling episode can only be an hour to an hour and a half, and you can spend no more than 2% of your income in that episode. And so when you're considering moderation with your clients, you want to set forth those guidelines, and if you decide moderation is something that is appropriate for them, then you have these guidelines and see if the individual can adhere or stick to these guidelines. If the situation happens where they're unable to adhere to that guidelines, then maybe abstinence is the best way to go. However, it still allows the client to have a learning experience and bring them forward. So moderation is something to consider, but generally you want to consider the situation and the facts for the client. Thank you very much.